Hello, everyone. Good afternoon. My name is Paweł Zagożdżon. I am from Poland. I am a psychiatrist and I work at the epidemiology department at Medical University of Gdańsk. And I'm going to present data from a big nationwide study on the health in elderly population in Poland, Paul Senior II. There is no data about these aspects of health and behaviors in Poland, in Eastern Europe, because it is not very popular, it was not very common. It was really very difficult to encourage, to persuade, to make scientific committee, to include this questionnaire, to set off a huge number of many questionnaires, many aspects of health in this Paul Senior II study, which was sponsored by Ministry of Health and Nation Program for Health. So it was successful, mainly because URL is very short. It consists of 5 questions, and because it was only 1 page, we managed to get the approval from the scientific committee. So we examined differences in late life depressive symptoms over different religious activity using nationally representative data from Paul Senior II study. This study has been performed in 2018 and 2019. This is the 2nd edition of originally performed in 2011. So we have some comparison concerning some different aspects of health, but this is the first time when we ask about religiosity. It was not easy to perform this. It lasted 2 years, but successfully, I mean, luckily, we were able to manage before Corona pandemic. There's one interesting story behind it. When nurses started to visit the homes of the respondents, one respondent called the TV show, satirical TV show in Poland, and they started to mock this project because of religious questions. Yeah, as you know, now we have a right-wing government in Poland, and they thought that it had something to do with it. That they were interested, Minister of Health was interested, what is the religious activity and whether the government should do something about it. Yeah, so this is the awareness. This is the example of the awareness of these issues in Poland at the moment. But we managed it, and as you see, almost 6,000 respondents participated in this study with an implementation efficiency of 56%, and more than 90% filled the questionnaire on religiosity. There was a 3-stage sampling scheme, first communities, then villages, streets, and finally individual responded based on the individual personal identification. We used geriatric depression scale, GDS, it is a 50-point version. We considered depression when the GDS was above 4 points. We included into the analysis only those respondents who were without severe dementia. So the cutoff point for mini mental state examination was 19 points. And as I mentioned, we used Duke University Religion Index, DUREL. This is a very busy slide. This is just to show you that it was a representative sample, and the paper describing the methodology has been published previously. And this is the result on depression in Poland. And what we found, it was very interesting that depression is increasing with age. Yeah, so we see here the prevalence, the mean GDS score within different age groups. And contrary to Western Europe, depression increased with age in Poland. In developed rich countries, it has been noticed that depression is lowering with age, probably because of better wealth, better support, the better functioning of institutions responsible for healthcare. This is also interesting to see how depression is changing depending on the level of functionality in respondents. These are the well-known geriatric scale of daily activities. And you can see if there is no disability, there is a low level of depression and increase with severity of the disability. Why it is important? Because we noticed that there are some very interesting relationship with extrinsic religiosity in terms of attending the church. You are not able to attend the church sometimes because you are disabled. And this is obvious reason for being depressed, not because not attending the church. Yeah, so this is the well-known phenomenon in epidemiology called reversed causality. Yeah, and we are struggling with this problem. And probably you know the questions from the Durrell, the first two questions concerning extrinsic religiosity. And this is the data from Porsenior 2 study group. How often do you attend church or other religious meetings? And you can see the most frequent answer, more than 40% once a week. This questionnaire has been validated in younger population. And we noticed that young people used to answer something like 30%. Yeah, so it is also not very surprising that old people attend church more frequently, but at the same time, old people can be not be able to attend because of some different health problems. And the differences among gender, among different sexes, you can see here, more than once a week. Obviously, there are more women who answer these questions. A few times a year, more men. The second question, how often do you spend time in private religious activities such as prayer, meditation, or Bible study? So asking the members of the Catholic community about Bible study is not very usual. It's quite controversial maybe, but prayer and meditation, yeah. So you can see here again, daily 40%, so which is a good number. With difference again between men and women. Yeah, so it is quite interesting finding. And then three questions about intrinsic religiosity. Three questions from the Durrell. In my life, I experience the presence of the divine, God, for example. And these are the answers. Definitely not true, tends not to be true, unsure, tends to be true, definitely true of me. And again, almost 40%. So maybe our Polish population of elderly people is very religious. My religious beliefs are what really lie behind my whole approach to life. Again, definitely true of me, 30%. So that expressed that the answer showed that there is a high level of religiosity in Polish elderly population. And finally, the last question from this Durrell questionnaire: I try hard to carry my religion over into all other dealings in life. Definitely true of me, 35%. Yeah, tends to be true, 31%. So if I sometimes ask patients if I find it suitable or appropriate in the context of the problem, do you believe in God? And the most frequent answer is, I do not attend the church. Yeah. So different question, different answer. So maybe it expressed some changes, some transition in understanding what is the role of the institutional church, at least in Poland. Yeah. And here, this logistic regression, we use logistic regression to look for the associations. So the dependent variable is the depression, considered as a result or in the GDS score above 4 points. And here you can see in the first column univariate analysis, and in the second column adjusted odds ratio, and odds ratio has been adjusted for age, sex, and education level. We limited this analysis to those 3 variables. Maybe we will try to look at other aspects of health, but we think that these are the most important, and at this stage of analysis, the findings are quite interesting. So you can see a clear gradient, yeah, for the depression, for the protective effect of that organizational religious activity. However, again, it can be confounded, as I mentioned, by the level of functional level, the presence of disability. And maybe it is the example again of some methodological problems, methodological difficulties, and reverse causality. But if respondent answer that she or he attend more than once a week, then the risk of depression is halved, yeah, 50% less compared to those who never attend. Yeah? Once a week, more than 40% risk reduction. A very interesting finding here is about private religious activities, where we found at the borderline of statistical significance the effect of being active, praying, reading the Bible once a day. Yeah, it is the most healthy level of activity. If you try to pray more than once a day, maybe it can become more obsessional, and it can be problematic. The effect size is not very big, 40% risk reduction, but if we take the perspective that it is the Catholic population, then this finding, I think, is quite interesting and quite relevant. Among all 3 questions from the Dural questionnaire concerning intrinsic activity, the only one, if we look at the question and the answer separately, appears to be statistically significant: presence of the divine. Yeah, definitely true of me. 30% risk reduction for depression. And if we calculate, as it is recommended, the total sum of points of these 3 items, again, there is a statistical effect, the slight, not very big risk reduction concerning the intrinsic religiosity. So in conclusions, there is a relationship between a risk of depression and religiosity, extrinsic and intrinsic in the elderly population in Poland. And we hope that our findings have implication for understanding of resilience of mental disability in older age in Poland, and for public health policies aimed at promoting favorable attitudes and practices. However, we know that there are a number of methodological limitations when you want to draw the conclusion on causal relationship based on cross-sectional study. And maybe in the future we will plan some longitudinal studies. So the key issue is that whether there is a reverse causation in this finding. Thank you very much.
Thank you, Paweł. There is one question in the chat, or anyway, a sign in the chat. Shall we see what's over there? Well, there may be more questions coming up. In fact, you presented 2 parts. The latter part was about the results, and the Polish results seem, I can say, because quite a good, you know, these types of studies, they fit into the international literature. So that's good. But the first part was the societal part of just getting permission to study things in which you have your curiosity and the political component. Okay, yeah. Well, you can repeat.
This is. There was a comment from the chair that the first part of my presentation, that the preparation for the study was the consequence, was the results of some problem that express the level of awareness in the society about the role of religion. And the second part, as a result, is concordant with the results from other studies, findings from other countries.
I was intrigued by the finding about prayer. Prayer in these types of study is a bit weird because it's only about the frequency of prayer and not about what you pray or how long you pray. So there are many more things to discover than praying. But the coefficient, the uncontrolled coefficient, was significant for daily prayer and for more depression. And when you controlled it for the demographics, it was significantly the other way around. Yeah. What is your explanation? What's confounding? What of the three confounders, or how many did you have? What did it explain?
Yeah, as I mentioned, this multivariate analysis included only age, but it is the most important. Gender, again, very important, and education, very important. I was afraid of multicollinearity. Just in the logistic regression, it happens, and I think that the age and gender is really very significant aspect of this, and that some women can pray more frequently. If we should become older and start to suffer some problems with health, it can be confounded, and education. Yeah, again, maybe being less educated, you pray more, or vice versa. Yeah, it's really difficult to explain because it is a cross-sectional study. But I believe that there is a causal relationship, that there is an effect, there is something behind it. If we found a relationship between prayer, Bible study, and the depression.
Yes. And the Roman Catholics in Poland do not read the Bible, you already said?
I think that we did not ask about the Bible reading. Yeah? Of course, maybe there are some attitudes related to reading the Bible, but this custom, this behavior, just to spend some time on thinking about spiritual aspects of your life, it can be helpful. Yeah. Personally, of course, believe that the Bible is the best source of this kind of healthy thoughts. But yeah, in Christian community, like Catholic country, or just secular trends that we observed in Poland, maybe it could be a sign that something is changing, maybe towards reading the Bible.
How do the Polish researchers or people in care institutions respond to your findings? Are they willing to accept your findings? And
this is the first time I announce it. We will see.
Oh. Thank you. Okay.
What do you expect? What do you expect? How they will?
This is the task for us, yeah, to show in the role of the healthy spirituality that it can be helpful. Yeah.
In Poland, there's also a group of psychology and religion who research on all these kind of things. Do you know them?
Yes, I know them. I have no opportunity to cooperate with them, but I inform them about this.
Yeah, okay. Madam Anchik, I think.
Yeah.